Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer at Community Memorial Health System. And I'm joined today by Dr. David Westra, Neurosurgeon. Welcome, Dr. Westra. So nice to have you here.
Well, thank you for having me, Stan. I appreciate the invitation.
You're so welcome. This is a great opportunity for our medical staff and community to learn more about you and your practice. In order to do so, we have a few questions that will enlighten us and give us better insight into your specialty. First of all, tell me a little bit about yourself. What brought you to Ventura? Where did you do your training? And a little bit more about what you find fun about Ventura.
No, that's a good question, Stan. So, long story short, I was born in Tucson, Arizona, and my dad is a geologist, so we traveled all around the world. So I lived there until I was 5, and then we went to Houston for a few years, and then we actually went for elementary school to Santiago in Chile. So I fluent in Spanish because I had to learn real quick. And then we moved back to Texas, where then I went to high school and undergrad, did chemical engineering, and I was most interested in genetic engineering, but then realized, well, working in the lab at all hours of the day and night wasn't what I found most fascinating, and I like to help people, and so that's when I got interested in medicine. So I went into medical school. Immediately, I was always fascinated with the brain and how things work, and just what makes us us, and that's really what got me interested in neurosurgery, the chance to help people with that, and at the same time kind of learn what makes us tick and how everything works. And so I did my neurosurgery training in Loma. I did a fellowship up in Seattle, Washington at the Swedish Neuroscience Institute, focusing on minimally invasive brain and spine techniques, where I did a lot of minimally invasive spine, a lot of pituitary work. And then the reason I'm here is because my chairman from Loma was best friends with Mustafa Abu-Samra. And so we got to meet and hit it up, and we had the same thoughts about patient care and individual care for patients. And so that's why I've been here for the last 12 years.
That is incredible. I've known you for all these years. I did not know you were fluent in Spanish. That is an enormous asset, particularly in our community.
Yeah, it comes in very handy. I'll have to say that sometimes I surprise people because they hear me talk and they say, "You don't look like the person who could speak Spanish. You look, no way, how are you saying that?" But that's where it came from, when you learn from an early age. So I'm not perfect, but I can converse fairly well, so that comes in very handy. So, but here in the community, I do a lot of mostly spine work, as you can imagine. That's one of the most common things in the community, but also we treat brain tumors, like I said, pituitary tumors. I do actually a lot of peripheral nerve work as far as carpal tunnels, cubital tunnels, and things like that. So anything that's nerve related, we usually will take care of. And if there's an off chance that it's something that we know can't be done safely here, I know all the people around that are the best in dealing with this, and I would make the appropriate calls and referrals. So I'm a member of multiple organizations of neurosurgery, so I go to a lot of these, so I know a lot of the people, and therefore you really know who the best is in doing certain things for the most part.
Well, that's very insightful. It's really one of my questions, what are the specifics? And I presume you work quite a bit with our pain management specialists as well, for those people with nerve impingement, etc.
Mm-hmm. Yep, absolutely. Pain management is key. Physical therapy is key. Those tend to be more of the conservative modalities, and if those don't work, that's usually when we would get involved to see if this would be something that surgery provide benefit, or if there would be any of the other options that can at least be tried before. Because in general, we try to be conservative and consider surgery only if nothing works in that way, or if people are losing function, and say, you're going to need an operation most likely. So, but I think that's the way that I would want to be treated, so that's the way I treat everybody else.
Well, I have the great luxury of having worked with you and seen your meticulous involvement in the case, and I also have the knowledge that you use your medical judgment to determine if surgery is even an option for that particular patient. And a lot of people don't realize that making the judgment as to whether or not surgery is indicated or medical management is preferable is a critical talent for a surgeon.
Mm-hmm. So, I would agree, and I think that's really, if you asked any surgeon that you have, I think that if they say what's the most important part, patient selection, because there's certain patients you can help, some that you can't, and to explain why or why not is really the key. And I think it's really the key in terms of setting realistic expectations. When everything goes great, everybody does better, then we're obviously all happy. But this is not a perfect world and things happen. So as long as I find that if you provide them the counseling and you give them the information at a time, that even if there are some, turbulent times coming, that for the most part, they know you're a team with them and you'll get them through, and, they do okay.
Very nice. What ages do you treat?
So we predominantly treat adult patients. So for pediatrics, it tends to be a fair bit different because the pathology tends to be different. So pediatric neurosurgery tends to be shunts for hydrocephalus, pediatric brain tumors, occasionally scoliosis, and those are very specialized things. And given the demographics of our community, those are things that we encounter very infrequently. So normally those would be ones that we would transfer, but pretty much all adult work is what we would take care of.
Very good. Where is your practice located?
So my practice is across the street from the old Community Memorial Hospital. So we're at the professional building in 168 North Brent Street, and we're in Suite 4008. And that our practice has been, believe it or not, it's 60 years old this year. And
Wow.
We've been in that same location for about 25 years.
Well, that's really convenient for you to access the operating room so conveniently.
Yep, absolutely. I mean, convenience is key. As you know, with everybody now back on the roads after COVID, it's just getting into places. Even getting to St. John's, which I think is 7 miles away, sometimes depending on traffic can take 30, 40 minutes. So having me being across the street is always great. And of course, with emergency medical care, then I'm right there. And I live about 5 minutes from the hospital, so we're always available and close if there anything emergent comes up.
Boy, what a luxury we have in your accessibility. That's
Yep.
so really appreciated. We know now about your professional life. Do you have any outside interests, hobbies? Do a lot of skydiving, etc.?
Well, unfortunately, when you've seen some traumas, it makes you a little more conservative when it comes to that. It's like briefly when I was growing up, I thought that motorcycles would be cool, and after doing this, I'm never going to go on a motorcycle. It's like, I've seen too much. But as far as my hobbies, the thing I like the most is music. I've been playing guitar for almost 30 years. So it's one of my favorite things to do, and blues is one of my favorite things to play, and rock and jazz. And believe it or not, I got started playing heavy metal when I was in high school. That's how I got started in all of this, and love Metallica. That's what got it started. But now I'm playing, classical, flamenco, and occasionally, when there's tough times, I'll play a little heavy metal still. But a little bit of everything, and so that's one of my favorite things. Also, being near the ocean, I love everything to do with the ocean. So I like to go kayaking, go on the water, go sailing on the ocean, and I have a little kayak that I can take out there, and so it's a great way to decompress. And of course, I got 3 kids, 8, 6, and a 2-month-old now. So we've got full times with them, but it's a lot of fun to see them grow. And and now they're playing piano, and so I'm playing guitar along with them and stuff like that. So it's been great.
Yeah, what a great way to share your interests and your hobbies with them and
Yep.
enjoy that family time.
Exactly, and the only thing would be travel. So we love to travel. Like my sister, she lives in Amsterdam, and all my family lives in Holland, except for my parents who still live in Texas. So we travel all around, and they're actually going to come visit in August so they can see the little one. So
Wow.
we love to do that. So we've taken the kids to Italy, to Spain, of course to Holland and Belgium, and all around. So we've tried to get them appreciation for the world's a big place, and there are a lot of other different cultures out there as well.
That's beautiful. Wonderful. Thank you for sharing all that individual time
Yep.
and interest with us. This next session is one of my favorite sessions, and it's because we ask you almost stream of consciousness questions.
All right.
So there is no right answer, no wrong answer. You'll just answer the question as best you can.
Alrighty.
When on an airplane, would you choose an aisle or window seat, and why?
Oh, window seat every time. I just love to look out the window. I mean, if I could come up with something, I would just love to be on the space station, just look out of the window and just see how amazing the Earth is from space. So that's the closest I could get to it. So just to see everything, and especially when you fly over an area that and you get to see everything, it's it's amazing to see.
I'm
so
with
I'd always
you.
be in the window seat.
Yeah, that's my bias. Do you prefer an office day or a surgery day?
Surgery day.
Spoken as a true surgeon.
Yep, I love surgery. That I can't hesitate. So.
If you didn't become a physician, what was your backup plan?
Oh, that's a good question. So,
Heavy metal musician?
Yeah, well, that was a consideration when I was in high school. Heavy metal musician. When I was a little bit before that, I wanted to actually be an Air Force pilot, and I wanted to fly the SR-71 Blackbird. So if you come to my office, I have a few Blackbirds and other things there. So that gets a lot of questions. But I told them they retired that, and so then I looked into Air Force RTC. But then they told me I didn't have glasses at the time, but my vision wasn't quite good enough. So I said, I'm not going to do that. So I went into into this line of work. But also my patients asked, well, what do you fly now? And I said, well, one of my good friends, her dad was a pilot for Alaska Airlines. And he always said, you know what, that doctors, they can afford a plane oftentimes, but they don't have the time to practice their skills. So their fatality rate is a lot higher than the general public. So that really caught my attention. So I said, I'm not going to be doing any of that. But I probably have to become a musician as a backup. But I have a lot of other interests. So.
Well, I'm glad we get to keep you as a neurosurgeon.
Yeah, I don't have plan. I've been here for 12 years. I plan on being here the whole time. So
good.
That's my plan.
If besides being a neurosurgeon, if you had a choice between superpowers, being invisible or flying, which would you choose?
Flying.
Yeah, I got that hint.
Yeah, we got that hint,
When you were in medical school, what was your favorite subject or class in medical school?
I'd say my favorite class was gross anatomy. So I think it's one of those unique opportunities. Initially you have to get around kind of, the smell and all that other stuff, but just to be able to dissect all that and to see how we're wired. And one thing when you look in books, it's one thing, but you see it for real, it's something else. And then of course, wanting to be a surgeon as well, that really gave me insight. Even though the irony was that even then I knew I wanted to be a neurosurgeon, and unfortunately our cadaver, the brain, wasn't very well preserved. So I was a little irked when we got to that part, and it's like, hey, wait a minute here, So.
But you persevered.
I persevered, yeah. So had to do what I had to do.
When traveling in an automobile, would you rather be the driver or the passenger?
The driver. I guess being the surgeon mentality, I always want to be in control. So
I could see that.
Yeah.
Card games or board games? What's your favorite game to play?
My favorite game to play? That's a toughie. I would say at the moment probably Candyland with the kids. It's simple. I don't have to think, and they're always happy.
How apropos.
Yep.
What is the most interesting thing about you that we would not learn from your resume alone, although you've already given us a few hints?
Yeah, I would say the most interesting was my experience growing up in South America and Chile, because at the time it was when Pinochet was still dictator, so there was no Western businesses or anything. And as a kid, I remember I was very upset because they had no McDonald's and I couldn't get any of that, which I really wanted. So that was what I remember. But also too, I've been fortunate to be able to travel as much as I have and having family all around that I can be with. So I think that's one of the main things, along with, of course, my interests.
Thank you. If you could compare yourself with any animal, which would it be and why?
Ooh, that's a good question. I could say that my favorite animal is the orca because they're very intelligent, they're very social, and I guess also too, they're top of the food chain. So
well said. And your best advice, I love this question, that you would give your high school self: study more, be more careful driving, or what else?
I would say, you're going to have ups and downs, but in the end, things are going to work out. So just kind of relax a little bit and don't be as anxious or preoccupied about certain things, especially like tests and other things, which right now I don't even remember. But back then, were the center of your life in terms of, getting certain grades and this and that.
So with age comes wisdom.
With age comes wisdom, exactly.
Thank you. Thank you for tuning in to learn more about Dr. David Westra. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you so much.
My pleasure. Thanks for inviting me.
Oh, you're sure welcome.